Hi, thank you for joining me today. This is Dr. Traci Patterson with Holistic Center Treatment. And today I'm going to delve into part 3 of our series on CRPS. So thanks to you again for joining me today. On our last video, I talked about CRPS, being diagnosed, and also traditional treatments. So today I want to wade in a little bit further into CRPS and really talk about that brain-pain connection and also neuroplasticity a tiny bit as we start looking into this. So I want to share, as we move forward, a small excerpt from my book, Stepping Outside the Box, A Journey from Invincible Pain to Invisible Living. And I think it's really applicable when we start looking at chronic pain as a whole. So here we go. Pain is real. And patients are searching for solutions that are going to help them regain their lives. Patients of all ages are diagnosed with chronic pain every year, and pain doesn't discriminate. In the United States, over 100 million people are diagnosed with some form of chronic pain, and this is greater than cancer, heart disease, and diabetes combined. However, pain reaches far past our borders, and it affects an astonishing 1.5 billion people worldwide. Pain is a universal experience. It's serious and it's costly. Chronic pain patients want to be heard and understood. Their pain is real, and they're looking for solutions. They don't want to be told not to worry, that they don't look sick, or that it's all in their head. Everyone's story on how their pain began is unique, but there are always common threads. There are times when we know what causes chronic pain, and other times it's a mystery. Regardless, it's important for the individual to be heard, to find help and resources that they need that are going to help them regain function and regain their lives. Now, I'm sure so many people that can resonate with them, especially with CRPS patients. And the reality is, no one walks a mile in the shoes of a CRPS patient or their life. It's not possible. But when our physicians and our clinicians and even our healthcare providers can really do their best to understand what we're going through, physically, mentally, emotionally, relationally, with our isolation and everything else, it can really help shift things in a positive direction. And to better understand pain, and even centralized pain, CRPS, we really need to delve into that brain-pain connection. To understand that, we need to look at the central nervous system. And the central nervous system is the mastermind of the body. It controls every single function in the body. So again, it's the brain and the spine. And the brain is the most complex organ in the human body, with billions of neurons that send information to different areas for different tasks. And the spinal cord, think of it as just a super highway that sends and receives information, and it carries those signals from the brain through the entire body. And we may think of the brain just as one big supercomputer, and I've even referred to it as that before, but the reality is it's much more than that. Inside the brain, there are billions of little computers, as I'll call them as an analogy, which are neurons. And the neurons are so small that you can put 1,000 neurons on the fingernail on your small finger. And neurons take that information and they send the information through different areas of the brain, so the brain can then respond. So when we think about that, let me give you an example. When someone says something to us, that sound or that voice goes through our ears, and then it travels to different areas of the brain that are responsible for processing sound. From there, the message travels to additional areas in the brain, and the brain has to decide, how does it feel about what's said? And then it places an association, meaning who said that? Who's the person who said that? And then it goes to another area of the brain to try and figure things out. So that's how complex it can be. So anytime we hear, feel, see, smell, or taste something, Our brain responds based upon our past experiences and what it knows. So when the neurons send the signal, the brain goes off our past experiences. And then that perception of that signal becomes the dominant information, the dominant signal that is then sent out to the body. So therefore, think of it this way: the brain's perception can become the reality in the body. So let's start delving into that. That's a big word called neuroplasticity. And everything we learn in life, if we think about it, we've learned through repetition. Walking, talking, reading, riding a bike, driving, using a computer, using a smartphone, TikTok, Snapchat, anything that we've learned through repetition. And our brain creates a file for it, and then that file goes into a filing cabinet drawer. And in the same way that we can learn to read and walk and talk and ride a bike or drive a car or use a computer, our brain can also learn CRPS. It can learn chronic pain, and it creates a file folder for it. So if we think about that filing cabinet, that CRPS folder is now at the very front of that filing cabinet drawer. So that helps make sense of when we go to do something and our brain comes upon the exact same folder, which is CRPS, it's going to respond the exact same way. The brain's perception becomes the reality in the body. But we can't delete that folder. As much as we would love to go in and hit delete, our brain won't allow us to delete a folder. Instead, what we can do is we can use neuroplasticity, which is our ability to reshuffle this filing cabinet drawer and essentially rewiring the brain. Because I don't care how young you are or how old you are, the reality is our brain is always changing, it's always adapting, it's always rewiring. And we can use that to our advantage, especially when it comes to CRPS. Now, with that said, let me make it very clear. A CRPS patient is not imagining the pain. It is very, very real. And as someone that lived with it, I can attest to that 10 times over. It's not psychosomatic. It's not made up. It's not imaginary. It's very real pain, but there has to be a way to move forward, and just treating the symptoms isn't working. And that's where we have to take a step past that. We've got to look at that brain pain connection. We have to look at the brain. We have to look at how CRPS, another analogy, could be like a virus or malware in a specific area of the brain, like the limbic system. So now all of a sudden the limbic system is sending out the wrong information, the wrong message. But when we can start reshuffling that filing cabinet drawer and using neuroplasticity, then all of a sudden that can make a tremendous difference as our brain is rewiring and relearning that it's okay to take a step, it's okay to put a sock on, a shoe on, etc. And that starts delving into neuroplasticity. So as we move forward in this series, we'll also do another video next time on part 4, specifically delving into neuroplasticity and how a CRPS patient can use that to your advantage. So thank you again for joining me today. I know these are small sniglets within these videos on information, but I think it's easier to take in that information in small bites than be able to try and sit through a very long video. Again, thanks for joining me, and I look forward to seeing you next time.